Asthma is a chronic inflammatory disease, and symptom control requires more than just treating acute exacerbations. Proactive management is key to preventing long-term airway remodeling and improving patient quality of life. When asthma is well managed, patients breathe easily, sleep soundly, and enjoy their daily activities without interruption. Yet, maintaining that control requires consistent, proactive effort. Better asthma control starts with daily habits, such as good inhaler adherence. Remember, per GINA, asthma treatment follows 2 tracks. Track 1 uses a combination of inhaled corticosteroid, ICS, formoterol, as the daily controller and the as-needed reliever in a single inhaler, making it easier for patients to adhere to their treatment. Track 2 uses a separate ICS and short-acting beta-2-agonist SABA inhalers as preventer and reliever. Remind patients on Track 2 to use their inhaled corticosteroid-based preventer inhaler every day, even when they feel fine, to suppress airway inflammation and reduce exacerbation risk. Correct inhaler technique ensures sufficient medication delivery and achieving optimal clinical outcomes. Knowing triggers, tracking symptoms, and staying current with vaccinations are also key to keeping asthma in check. At every scheduled review, or after any change in therapy, use a systematic process to assess control and identify risks for future exacerbations. 2 practical tools support this process: the Asthma Control Test and the Asthma Slide Rule. The Asthma Control Test is completed by patients aged 12 and older before the consultation. For children aged 4 to 11, use the CACT version. This validated questionnaire takes about 2 to 3 minutes. Patients record the number corresponding to each answer, sum the scores, and bring the completed test to the consultation. A total score of 20 or higher shows good asthma control. Thus, therapy can be maintained and adherence reinforced. Scores between 16 and 19 show partially uncontrolled asthma, demanding assessment of adherence, inhaler technique, and considering stepping up therapy. A score of 15 or lower shows poor control, requiring urgent review, increasing ICS dose, or adjunctive therapy. Here's what it covers. 1. During the past 4 weeks, how much did asthma prevent you from accomplishing daily tasks at work, school, or home? 2. How often did you experience shortness of breath during the past 4 weeks? 3. How frequently did symptoms like wheezing, coughing, or chest tightness interrupt your sleep? 4. How often did you use your rescue inhaler or nebulizer medication in the past 4 weeks? 5. How would you rate your overall asthma control over the past 4 weeks? Additionally, for patients on GINA Track 2 using separate ICS and SABA, use the Asthma Slide Rule to quantify their SABA use. After the 4th question, asking about the frequency of rescue inhaler use, use the Asthma Slide Rule to ask how much SABA, also known as reliever, rescue, salbutamol, or albuterol, patients think is acceptable to take in a year, week, or day before a review is necessary. The slide rule converts the reported number into a daily or weekly average. For example, if a patient uses 3 canisters per year, that may translate to more than 2 puffs per day, a level that warrants further review. Over-reliance on SABA, greater than or equal to 2 puffs per day, or greater than or equal to 3 canisters per year, is associated with increased risk of asthma-related hospitalization and mortality. Poorly controlled airway inflammation requiring step-up ICS therapy. Potential for beta-agonist overuse, leading to paradoxical worsening of symptoms. Over-reliance on SABA indicates issues with adherence, inhaler technique, or a need for adjustments in preventive therapy. To sum up, consider this. If patients wake up coughing at night, use their reliever more than 3 times a week, or struggle with daily activities, it's a clear signal that their asthma isn't fully under control. So, remember to incorporate these tools into every follow-up appointment. Encourage patients to use their preventer inhaler daily, review their personalized action plan regularly, and schedule checkups when necessary. Now, time to solve a short quiz to reinforce your learning. A set of selected IPCRG resources will be available for you at the end of this breath.